I'm here today with Mark Oakford. Now, Mark has carried out single-handedly the UK's largest independent study around COVID-19, around the COVID-19 deaths, around COVID-19 isolation, and around COVID-19 tests. Hi, Mark. How are you doing today?
Fine, Friday, how are you?
Yeah, great. Please, could you start by just giving us a bit of background to why you got involved in this piece of work?
Yeah, I was involved in another sort of voluntary campaign, and when the lockdown started, we're together with a group of friends, and one of them had written some freedom of information requests to local authorities, 17 in total,
Right.
to ask about the death rates and stuff. And I was quite alarmed by the numbers that he got back. It was something like three deaths and 150,000 people. And I've got a bit of a background, well, quite a long time ago, teaching people how to use basic office applications. So I've been involved with other freedom of information sort of campaigns before. So I put the sort of two and three things together and sent a load of emails off and just sort of seen how we got on. And we've done very well.
Right. And you said you sent off a lot of emails. Could you tell us how many in total you sent off?
Yeah, I've got it on a little slideshow here, which I'll share my screen for you.
Okay,
We'll go through it.
that's great.
Okay. Okay. So we've done a survey of 2.38 million civil service staff up to now via freedom of information. I'm not going to read through every slide, but basically what I've done is I've applied to each government office within each city and county. So your police department, your fire service, your county council, NHS trusts, in virtually every county in the country in the UK. So that's what we've done.
So this is all the public facing bodies,
Yes.
most of them within the UK.
Yes. So what I thought was the numbers that are published on the telly, we wanted to try and get a comparison of how we could get a big enough pool of data. And I realised that doing it by freedom of information, asking for the workplace data on the staff is obviously an easier way to go. So anyway, why and how, I think that's what you're asking in it. So here's what we're going to talk about. So we'll go to that first. So the original 17 things come from Francis, and I think I'm right in saying it was 350,000 people. We've already spoke about this. I've got previous involvement in FOI campaigns and a little bit of background in using Excel and applications. So I decided to put them all together and see where we went. So up to now, it was accepted at a very early stage from UK Column, as you know.
Yeah, I believe that was an article by Ian Davis. Is that right?
Ian Davis, yeah.
Yeah.
Sorry, no, it's Ian Smith. Ian Smith. Or is it Ian Davis? I can't.
Ian Davis.
Ian Davis, yeah. Is it? Yeah, it is Ian. It is Ian Davis. Yeah, I've got Ian Smith doing something else. Sorry, Ian. So yeah, so the link to the article is there. That was published on the 11th of October. A new one's being written as we speak, and then obviously it's being accepted into the legal team. And
yes, I think that data was running from January to the one in the article was January to August, and the results at that point were was it 1.6 million people?
It was you're on about the ONS data or mine?
No, so this is the UK column data. They were reported on your data collection up to that point, weren't they?
Yeah, it was done from the start of the pandemic up to about a week before the article was written. But some of the statistics which they've used to calculate population numbers are only based every 6 months. So some of them are only up to July and some are up to August. But it's all clearly defined anyway. So the data which we looked at, this is what we wanted to know. We asked each of these organisations the total number of the workforce, how many have died from COVID, how many have been admitted to hospital. Question 4 relates to positive tests, and the last one is isolations. So that's the 5 questions that we wanted to gauge. Initially, it was just the number of staff who I was interested in, judging by what Francis had got back. I asked these questions, the other 3, because we're told that the hospitals are bursting at the seams. Everyone's testing positive, and also that people are having to isolate left, right and centre. So I thought, well, I might as well get them numbers as well. Okay. So here's what we've done. We wanted enough data to get there. So I sent 1,392 emails off. Now, about approximately 300 to 400 of them were old addresses because the database that we used was from 2012, but it was the most complete database that I could find in one place rather than hit searching here, there and everywhere. But we still got 1,000 acknowledgements, which is 1,000 government officers. And the target, what we've got in is there. After 680, the data what we've got on here is based on 671. We've just got them other 9 to input at the moment. So what they do is, this is from the article in the UK column. So at the top paragraph, what they've done is they've worked out the working population from the census. Yeah, so it was 56.1 million. So they've separated it from England and Wales. Put an increase of 6% on the working population because the population has increased 6% since 2011. So they put 6% on top of 36. 6%. Where's my cursor then? Oh, sugar.
So when we say working population, it's, as you're going to tell on the next slide, I can already see.
Yeah.
65.
Okay.
So 65.
Yeah. It's 18 to 65 because the questions which I asked here are only to workplaces. It was concentrated on that age specific group, and the ONS do publish data on that working age group, so it was able to do a direct comparison. Yeah.
Right. Yeah.
So the working age population is currently 36.7 million because 94.6 population. 59.5 is the population of England and Wales. England have 94.6%, so therefore that's 94.6% of this. So that's your working population for England. So according to the ONS, the age standardized mortality rate, what that means is that they're saying that 16.6 people in every 100,000 up to the point of at the end of August have died of COVID-19. So this is before, while the pandemic was building, during the peak periods, and right up to the end of August where we were coming out of lockdown. Okay?
Yeah.
My data is up to, well, yesterday. It depends when they've applied in last month, but my data is right up to date. So based on this 16.6 per 100,000, that equates to a total of 6,092 of working age that they're saying have died of COVID based on their statistics. Okay? So that's what we were calculating against. So here's the actual data sheet from the ONS with the link at the side to back it up. And if you look at this cell here, 16.6, that is 16.6 per 100,000, age under 65. Children aren't counted because statistically, although a few have sadly died, they don't actually come into the equation. So that is basically your working age population. That's the mortality rate what they're publishing.
Yeah, and just if you could just also go into this 16.6 figure.
Yeah.
Because from the article, I understand that when the government are reporting that people have died from COVID.
Mm-hmm.
Now, some of those within that group,
yes,
I think it's 96% have pneumonia, influenza, and COVID, but it's going down as COVID. Is that got that right?
That's been changed 4 or 5 times along the way. The death count, the way they've counted them, they're back on the.
It's changed. Okay.
They're back on the 28 days.
Was it that at one point that's how they were counting it?
Yes. Well, if you look at the case, the report that was done by UK column, there was 46,000 deaths, and that was done in October. Now, if you look on ONS now, the death count's down to 36 or 33. Well, I've got that slide in a minute anyway to show you. So the COVID deaths.
So that's changing all the time. How they're
being reduced because they're getting caught out on so many things. They're having to reduce. You're having to change. They done it yesterday. They done it again yesterday.
Did they?
The graph that they've used for the lockdown has been found to contain data which was invalid, and they've just apologised and said, "Okay, sorry about that." So anyway, so that's just a backup of where the ONS data has come from. Yeah. So through my survey of these 2.38 million people, there's only 100 confirmed deaths. That's the NASMR, age standardized mortality rate of 4.2 people and not 16.6.
Yes.
Okay. Now this is on stuff that's actually happened. This is on, death certificate, but they can still be queries on top of this. But this is what has been reported to me, that people have died within the NHS and within the county councils. So this is stuff that's happened, not models, not projections. Well, this is what's actually happened. This is from the start of the pandemic, from day one up to the day which they returned their freedom of information. I requested them on the 13th of September, so they will have come in between the 13th of September and yesterday, because some are arriving late. So it's very, very, very recent data. Okay, here's what you were talking about before. So if I apply my ASMR of 0.042 to the working population, it only comes out with 1,541. Now the ONS are quoting 6,092. So that how is that different? Because I've got a survey of 2.38 million people, and it's all freedom of information requests from the government. It couldn't be any more. So,
and I think the really interesting thing as well is the people that the organisations you are serving, as I've said already, are public facing. Including the police, who were mixing with the public. Yes. Up until August, and I think they only started wearing masks at the end of August. So, it's very, very interesting, this data.
So if we, and I know this isn't a proper medical thing to do, because I'm not medical or scientific or a lawyer or anything. I've just done this off my own back. If we applied that hypothetically, that ASMR to the population, we come out with a death total of 2,856. Okay. Now, here's the NHS table, which shows you how many people have died up to now in the UK from COVID alone. There's the number there, 1,626, which leads more towards my calculation. Yeah, because obviously it's not finished yet, and you're going to get more through this winter.
Yeah.
Because this is based on stuff that's happened, and the more data that goes into this, the more accurate this number becomes.
Yeah, I think you've mentioned that it actually seems to be reducing every time you add in data.
Well, if you look at the UK column in October, it was at 0.0046.
Or 6, yeah.
Yeah. So it's gone down, and obviously as you put more data in, every time you put a death in, obviously the ASMR goes up. But then you put another 1,000 people from the next place, 10,000 people from the next place where there's no deaths, and it just gets absorbed. Yeah. Okay. So I've forgotten at which rate we were going to bring the data in. I think here it is now. Okay. So if we go back to the questions which I've asked, some of these organisations have written back. So we'll go to the results. Here's the results, broken down into...
This is the very large data set that you've collected, isn't it? This is the whole master set of data.
This is a summary of the actual sectors that I've covered. So you can see you've got city councils, borough councils, NHS CCGs, Welsh health boards, fire authorities. It's not every government department, it's about...
No. And you've got the police. There's some very interesting data from the police, I believe you were saying, down in the...
There is. I've got that covered in a slide in a minute, which is obviously the minimal amount of deaths with these people. But these figures are all collated in here. So these are the individual replies. Okay. Here's how I've come to my calculation. I've got 671 replies. 2.38 million people. That's the total workforce. There's been 100 deaths. And that gives me a ASMR of less than 0.4 now.
Yeah.
Now there's a little section over here, which are the anomalies. So if we go back to my presentation, there are 14 instances where people have said that if the answer is less than 5, 1 instance of less than or equal to 5, and 1 of less than 10. Okay. The exemptions, that they use something called exemptions, which if I show you, the exemptions are used when they don't want to give an answer, or they feel that there's some sort of reason why they shouldn't. So let's just put this filter on. Okay. So these are all the places. So you can see there's University of Bradford, Royal College of Art, Imperial College London. Imagine that, Imperial College London, the people who come out with the actual model to lock the country down, not giving any data out. How ironic. So these are where they've said less than 5. In each cell, there's a comment, which is their actual answer, which they give on the freedom of information. So if you look on here, and less than 5, please, the statement below, university approaching. So what they're saying is that they're not going to tell you because the number is so low that it might lead to the identification of individuals.
Whereas you've had returns for universities that have given you information, so there's inconsistency.
Completely conflicting. Completely conflicting. And as we were talking about yesterday, as you can see, there's the range. So there's Scottish councils, London boroughs, NHS England. They're all the people there's quite a few universities, but I've got data on quite a lot of them anyway. So the data, what they say is that they cannot give the data because it may lead to the identification of individuals. Okay, that's actually a clause within the freedom of information exemptions which they can use.
Yeah.
So if we go to here and we go to, let's go back here. We've got these strange answers. Okay. Out of 600, 431 have failed to answer at least one question. The exemptions, what they use is just far ranging. They can't all be true. So this is what I've tried to look at, but obviously it takes a lot of time to go through each individual one. So if we go back to here and we show you Oldham Council. Okay. Here is their answer. The council cannot provide a figure for any this as any response could potentially lead to the identification of individuals and their personal information, but this does not mean that there have been instances.
Does not mean there's been any instances.
So it's either less than 5 or it's 0, because less than 5 is 1 to 4. So now that you've seen that, you'll see the reason that's the reason why I've put them in. The less than 5 gets left as 0, but I have actually accounted for them in. Let me just move this in here. So for each less than 5 or less than equal to 5, I've given a minimum value of 1, a maximum value of 4 or 5 in that one instance, and then here a minimum value of 1 and a maximum value of 9.
Even where it said it might not be an instance, you still gave them, you've still calculated this with a 1.
Yeah, what I've done is on the basis of that one answer from Oldham Council, yeah, I was putting the less than 5s in as I was giving them a value of 1. Now the answer from Oldham Council leads me to believe that there's a clause within that freedom of information exemption, which means that they can say it's between 1 and 5 or 1 and 4 when it's actually 0. And that to me is wrong, but that one answer, someone's looking into it for me. But anyway, I've accounted for them here. So that this value here is without them instances, yeah? These values here. So this is, you can see it's very marginally increased by giving them all a single death.
Yeah.
It's very, very marginal. Giving them all the maximum death, which, you know, where I've got 671 replies and 95%.
And you're giving the max, and it's still way below the.
It's still below half. Now, if
from the government,
if you look at if I'm trying to give them a 9, and we look on, let's take that filter off. So if we look down that yellow column, yeah, there's no way there's going to be 6, 7, 8, 9, because it's just full of ones and noughts.
Yeah, so these are the other people who have responded with, very low figures anyway.
Mm-hmm.
So you really are giving them the benefit of the doubt when you're giving them the full amount.
Yes, that's just basically for what you call it in the trade, transparency. That's just to say, I haven't just put them in as zero. I've put them in as zero on that main count because of that one rule, but I've also accounted for them at the minimum maximum values. I don't think I can do any more than that.
No.
Okay, so from that data, we've addressed the death count. We've addressed the other issues.
Just to point out to people is that on this brilliant set of data that you've got, you can dig back down into every organisation's return.
Yeah, of course. Yeah, sorry.
Links it all back. It's so thorough. Yeah.
Let me just get one up. So, sorry for flicking about the screen.
No, it's absolutely fine.
So, if you see on these data, the split in the red and the green here, from all the green ones, it's just a conditional format on the cell. Tells me that this is data complete, yeah, which there's a filter down here for. And basically what that tells me is that they've just basically answered the 5 questions, yeah. Data's just very clean. If you look on here, it's full of the red comments. And what I've done is I've pasted each individual reply into each answer to say why they haven't answered. And then if I want to find out what their actual answer was, then when you click the link here, it will then open up their official FOI reply, so everything can be cross-checked with each individual answer. I'll just wait for that to open. So so each one of them on there has got a different answer. Let's just try and go. Has that come on? Yeah, well. So there's the Allerdale Council, and there's their responses. So every single set of data has got the official response behind it. Anyone who gets a copy of the folder, which is available online or through a shared link, will also get a copy of every freedom of information to look at.
Have you shared this online then?
The link is available online. I was waiting until the article was published, but I'll put it in with this with this presentation. I'll put it.
Okay, so people can actually go straight in and look at all this information.
You can go in, download the folder, download the zip folder, and then just extract the whole folder. If you try and extract it separately, the links won't work because all the path names will be changed. So download the whole folder.
Okay, that's great.
So we can just close that off there. So these are the columns that you've just brought me back around to. Hold all these comments. Now these comments are where basically they fail to answer the question. And lots of them use exemptions, but then again, lots of them don't. So if we just hover over some of them, there is no obligation to provide the university with the causes of death. This is, there's no obligation to provide. The university's control system does not record the staff. This is 431 answers, and there's 5 questions. So if you look at the triangles, this is how many questions they haven't answered. On the death count, most of them have answered, so that figure is pretty solid. But on the hospitalizations, the infections, and the isolations, the answers are just a joke, an absolute joke. But
and you would think any organisation, would be definitely at these times in a pandemic, they would definitely be holding this data.
Yeah, well, Friday, if we look down here, there's obviously a system in place, because these 5 questions, what I've asked, are getting answered without question. So there's 240 answers that have answered the 5 questions. So there obviously is a system that's been put in place. What's immediately obvious is that these are the 431 places are not adhering to that system.
Yeah. And
I would suggest, although I can't prove, that some of these exemptions will be to get out of answering the questions. But the exemptions are one thing. But when you've just got answers, just no information held, we don't track this data. This data is all part of track and trace. Okay?
Yeah.
This is called Pillar 2 data. And I don't want to get into reading all of this because obviously it gets a bit boring.
Well, it's there in the presentation if people want. Are you going to link the presentation at the end as well.
Yeah. This will be going in with it. This is a company they've got 4 laboratories within the UK. They were created in order. I don't know whether they were created in order, but they come out of nowhere, and they're responsible for the testing and the track and trace. And the pillar 2 data, if you just read the top one, there's pillar 1, 2, 3, 4, and 5, I think. So I keep losing my mouse somewhere. Sorry. So this is for I can't highlight it because it's on a presentation. So this is for virus testing for the wider population as set out in government. Pillar 2 testing reporting is only includes tests which were processed by a lab. So what that means is basically all the test centres that send the stuff away to a lab. Yeah, these are responsible for managing all that data. Now, these are owned by these people, and you know, so
AstraZeneca, BioCentre, UK BioCentre, yeah.
Again, on both these things, I think the links on the other one, the links at the bottom there, and the links at the bottom there, so people can look into it. And these organisations here are all like that one, and that one, and that one will be involved in another branch of COVID diagnostics, and then this one, that one, and it's the same people involved in every arm of it. There is no independent research or advice going on because it's just these promoting it. Just ridiculous. So anyway,
so we've got pharmaceutical companies promoting this and looking into this data and managing this data. Yeah.
So they are getting paid. They've been paid 12 billion quid track and trace in order to get all this stuff underway. These obviously
so they've got financial incentive to manage this data. Yeah.
Yes. Now, if we go back to our spreadsheet, there are so many answers in here where it quite clearly states that they're not tracking any data. This column here, yeah, this is about infections in the workplace.
So when they say information not held,
yes,
that is to be taken as exactly that. They're not holding that information. Otherwise, they're lying, aren't they? And there are, as public bodies, they're not allowed to lie.
Can I just interrupt? This is from look. This is ironic because I've just hovered on this by a chance, right? This is from the University of Liverpool, and I'm from Liverpool. I just want to show people this comment because this is a typical comment. Okay. Now, when you've said it's a lie, so
well, what I'm saying is that there are certain principles, the Nolan principles, that you have to adhere to as public servants, and one of them is that you can't lie. And so what I'm suggesting here is that if they're saying no information held, then we must believe no information is held.
But this is a university, and it's saying it does not have COVID-specific absence codes for cause of death in a university. Oh. That cannot be right.
No.
Now, I'm not going to sit here and flick through them all, but believe me, look, information. So 38 employees have reported diagnosed as COVID, but these haven't got access to any test data. So these are saying it's down to the individual. Some of them are saying it's down to the individual in order to tell the workplace that they're positive. Other places are saying it's down to the line manager to keep an eye on their wing. And that's how broad the answers are.
Wow.
We will not comply with your request in its current.
Well, I mean, anyone can get access to this now. You're going to share it, and they can look at the reasons they're given.
Yes. Okay. So let's get back to where we were up to. So there's obviously 1 second. Hello. Yeah, it's there, mate. There's obviously a system in place for the £12 billion, but yet 2/3 of government officers are not tracking what they should be. More importantly, which we've discussed before, why are they all sort of being brought into effect now? Why all of a sudden? And when did they change the strategy? And what you were saying earlier about the Ministry of Defence Police, the police stats. Sorry, I'm getting a bit confused. Someone's just come in my room, sorry. So if we go to the police stats. Let's just go to there and here. So if you look at the police service, the fire service and national parks, there's been no deaths in the fire service at all.
None at all.
There's been no deaths in the police service. The one death there is from a Ministry of Defence police officer, okay? Not a general police officer. And also the national parks, although the numbers are very low, there's quite, I've got data on about, I think it's about 10, 12 of them. So there's been no deaths in them organisations. Now, what's ironic about that is, as you've already alluded to, they have more interaction with the public and a wide range of the public than most people do every day.
Absolutely, yeah.
But they also all work outdoors in the fresh air. So, that's two things to consider just from that little out. And I'm sure when people look at this data, they'll be able to pull things from it that I can't see. Yeah. The other thing which we have spoken about Friday is the universities. And I think it's an absolute outrage. University students are locked up at the moment, being incentivised to go out and get COVID tests. And then they're placed in halls of residence, which obviously, whilst they're not getting no fresh air, are breathing grounds for any bacteria, virus. I'm not medical, but that's just common sense.
Yeah.
Now,
and I think it's showing the number of deaths.
So we can go to the sheet. I think it's along here, and just show you the data. So universities have got 6 deaths from 332,000 people. The ASMR is 1.8 people in 100,000. Right? Now, don't forget these numbers here, as you stated earlier. These people haven't had autopsies; they've just had COVID written on the death certificate. So that's what's been going to the ONS and where they get the figures from. These people haven't had autopsies, so there's no proof that they died of COVID. Mine's by far and away the lowest set of realistic data figures that there is. But there's reason to suggest that even them could be looked at if them people were given autopsies and could have other conditions that weren't known.
Yeah, absolutely.
So, I'm not sure where we're up to. So, I've covered the students bit at the bottom here. So, the NHS stuff was changed on the 22nd of September. Now, if you remember my questions from earlier.
Oh yeah, they're very similar to them, aren't they?
Now, if I'm just trying to get your screen out the way here. So, a number of data collections have been implemented to support incident management. It was collected at short notice, which 2 weeks is short notice in it, and the data has been classified. Now, it's my thought that what I've put in to such a large number of places, which goes through something called the Information Commissioner's Office, which has a central record, and obviously is a massive database, so it will have been flagged up that I've requested the same information from so many individual places.
Yeah.
It's bizarre that they've started calculating
using the same questions. Yeah.
Now, obviously, the number of patients admitted, the number of patients diagnosed is all, obviously, you look at the number of patients when you're looking at data, so they are standard questions, but the top bit just alarms me. And I've heard through the grapevine that it did have an effect on what they were doing, but I'm waiting to get that confirmed. So if we look a bit more into it, what's causing the lockdown now is this statement. Now we are not going to be able to get test numbers down whilst they are allowed to do this. It's astonishing. And this was published.
They're now combining the weekly flu and COVID-19 surveillance report.
Yes.
So the numbers they're giving out will be with
combined flu.
And flu. I mean, is that influenza and pneumonia? Is that?
From what I understand, it's all acute respiratory. Is it ARIs? Acute respiratory infections.
Yeah.
So it's all, or a majority of them, that are going to be combined in this report. So as we're coming into flu season, what I don't understand is the question on the top: why would you need to bundle? That's the word that they use. Why would they need to bundle a data set from the most deadly virus that's ever hit in our lifetime, seriously.
And surely you would want to keep that separate, surely.
Well, obviously.
It's so deadly, we need to keep it separate, surely.
Of course. But you know, this information...
And they've already bundled, according to the report in the UK column, it was 96% of those were bundled.
Well, if you look, you know, I've seen this article I've seen it about 100 times because I post it everywhere, but I've seen it on social media, and it's the attitudes of the people. And what I mean by that is it's dumbed down. They scroll through the information, they go, oh, that's another piece of data, and then that, which is the reason why we're doing this video, that's another piece of data. Nothing comes together, you know. So what I've tried to do here is just put things together. People are just scrolling past absolutely, you know, mind-boggling facts that are controlling their lives and just accepting it.
Well, sorry, I think we've just
have we?
To sort of, I couldn't hear you there.
Okay. What I was saying was, what I was saying was that I said I'm dumbfounded by the fact that these stats are available. They're widely available on social media, but people just scroll past them because they just see it as another statistic.
Well, I think to be fair to the general population, I think with the whole situation, we've had so much on our plates. As you know, I'm a mother myself, and so, having to juggle so much and to work and to there's so many pressures that I feel like we need someone like you to do this, and it's like you say, we need an independent body to be doing this. I mean, you're one man alone. Look at what you've achieved, and I really think we need to have an independent body looking at this data.
I certainly appreciate it.
Fantastic, you've brought it all together, and you're continuing, aren't you? This is not a closed project. You are actually.
No, not by a long way. Not by a long way. So this data's still coming in every day. I get between 5 and 10 emails every day. So I used to update the sheet like 2 or 3 times a week, obviously. So
how are you now? Now that they're combining the data that you're getting, is it separated?
What I've asked for,
are you still able to get this? Because you're asking those questions, are they? You know, my concern is that they're putting this. Is it still able to get the separate data here?
Well, I've only got about 15% of my data to get left anyway. Left to get back.
Right.
I've got 700 out of 800 to 900. So, you know, I haven't got much to get back anyway. I did notice over the last week to 10 days there was an increase in the number of deaths. People quoting 3s and 4s.
Oh right, okay.
And anyone who's quoted more than 3, I've actually sent it back to them and asked them to look at it again because the numbers are disproportionately out. Most have sent them back. Most have sent them back altered with revised figures.
Oh really? That's really interesting.
One unfortunate place. I had a few conversations with the bloke. Was just that.
So I think you mentioned when I was speaking to you yesterday that there is another report coming, another article coming out about this. So
it's getting written at the moment.
Find that too. When perhaps if we can add that into the comments on this video as well.
Yes. Hopefully
people will be able to access that too. But I just hope more mainstream media picks this up and starts looking into this. And you're providing everything there. There's no reason. You know, it can all be traced back to its original source. So it's a fantastic piece of work, Mark.
Okay. Well, should we leave it there?
I think so. But thanks ever so much. And yeah, as I say, everyone can see all the information in the comment section. And it's been lovely speaking to you, Mark. Enjoy the rest of your day. Take care.
Thank you, Friday. Bye-bye.